I am. Can you hear me? Yeah. Awesome. Do you know what? It's proper nice just hearing everyone talking, and I think probably like a lot of you, I've just been used to a lot of tumbleweed around this issue. So to be in a room of people that are like energised and interested, I'm finding just really exciting. So my name's Jen Ayling. I'm a UKCP registered psychotherapeutic counsellor, and I'm also a co-founder of Therapists for Medical Freedom. So we're a collective of psychological therapists who have deep concerns about the current COVID response and the impact that it's having on human health, civil liberties and social connection. We've written an open letter against vaccine passports, which is open to the public to sign. Some of you might have seen it, but please go and check it out if you've not already. But today I'm not representing that collective or trying to speak for anyone else but myself. I'm not really good with data, and I thought I'd leave that to the medical bods. So I'm a therapist, so I'm really about stories and connection. So I think I'll just start and tell you a little bit about my story and some of the stories of the people that I work with, and try and weave something together and shoehorn vaccine passports in there somehow. What is wrong with vaccine passports, I guess is the title of this meeting. How did I end up stood here on a Saturday afternoon that's sunny, kind of talking to you about them? And at what point did I, as a therapist, start to question the official government narrative and our national pandemic response? Well, I guess in the initial stages of the pandemic, like a lot of people, I was really bought into the idea of sacrificing kind of 3 weeks of my own personal freedom to help flatten the curve, to protect the most vulnerable. It's a sensible measure, I thought. Let's all be in it together. Doesn't that seem so long ago now? But I suppose my work as a therapist meant that quite early in the process, maybe just a few weeks into it, I started to feel concerned about the statistics and the stories that we were not being told. I saw on the news each night this endless stream of case numbers, ICU beds, transmission rates and deaths. But what I didn't see being discussed to nearly the same extent was what I was witnessing every day on the ground as a therapist. And what I was seeing was these hugely negative impacts of these public health measures that were supposedly put in place to protect us. The lockdown restrictions, the masks, the social distancing. I saw the profound loneliness and isolation they were causing. And as the months rolled on, I saw that on so many levels, these things were having a catastrophic impact on people's mental health, especially amongst the poorest and most vulnerable in our society. I've watched with horror as the government and the media have continued to whip up this fear of a virus that's beyond all reasonable proportion. It's true that it's a very nasty respiratory illness. I think I've had it and it was bloody horrible, I'll tell you. And each life lost to COVID is a tragedy. I'm not trying to downplay any of that. But for the sake of proportionality, it really is worth noting, and you can help me with the data here, but it is about a 0.15% fatality rate globally, roughly, and that most of us in this room would have a 99.5 to 99.7% of surviving it even without the vaccinations, roughly. I think there's a lot of dispute on but it's broadly ballpark. And so like many other respiratory illnesses, the vast bulk of fatalities are in the elderly and the clinically vulnerable. And yet sometimes it seems to me as if this really nasty respiratory virus has been transformed almost into a plague in our public imagination. COVID-19 has somehow become so high up in our global health priorities, it now eclipses everything else, even infectious or preventable illnesses with a far higher mortality rate. The measures we've brought in have often been at the expense of many other vital services that are essential for public health. Over the last 18 months, the government's pandemic response has crippled our economy in a way that will likely take decades to recover from. And while social distancing will have protected some people, these drastic public health interventions have also caused the loss of many lives. And as just one example, we now have a mental health crisis of epic proportions in this country. Anyone working in my profession as a therapist will tell you that mental health services are currently on their knees. Crisis care in hospital goes beyond ICU beds and ventilators. Time and time again over the pandemic, I've tried in vain to get clients who are suicidal or really acutely unwell into mental health crisis services, but those services became completely overwhelmed and almost non-functional about 12 months ago. And mostly that was under the weight of the pandemic and the lockdown restrictions. Even getting a GP appointment for mental health issues is increasingly difficult. And because of this, people are now dying in record numbers of suicide, of drug and alcohol overdoses, of treatable mental health conditions that are recognised far too late, or there just isn't the right crisis care available. But I'm not seeing billions being pumped into the mental health crisis right now. I'm not hearing about this on the news every night. And I believe that this hyperfixation with protecting everyone from this one single virus at all costs is in itself becoming a disease process. It's like we're all stood in the corner of a forest worrying about the health of one single tree that is diseased. And we're so distressed by it, so distressed about this dying tree, that we're throwing everything at it to save its life, throwing all of our resources, millions, billions, trillions of pounds to protect us, when all around us the fucking forest is on fire, right? And many of us haven't noticed it, because we're so fixated on saving this bloody tree, right? And so when I think about vaccine passports, I can't separate it from this wider context of our national pandemic response. What I fear is that these vaccine passports are kind of like a crystallisation of this very fearful and narrow and completely disproportionate set of public health measures. We're adding fuel to a system that's already obsessed with case numbers and transmission rates and vaccinations and deaths, and just bringing in these passports is going to just amp up our fixation on the virus. I think vaccine passports will provide the technological infrastructure to just embed these strange and skewed priorities into the structural fabric of our society, with increasing penalties and restrictions for those who disobey the health mandates of the government. And so I fear that vaccine passports will be a hugely divisive force in our world. They have the potential to split our entire society in two. They will create a two-tier society, dividing us into the vaccinated and the unvaccinated. And then slowly over time, we will be turned against each other. You can already see this happening. In the recent months in the media, we've seen an increasing rise of judgment and blame towards unvaccinated people for allegedly prolonging the pandemic, although there's no evidence of this. We are now seeing newspaper headlines decrying the pandemic of the unvaccinated, or that jabbed Brits celebrate after the unvaccinated get sick pay cuts. This is a dangerously, profoundly dangerous turn of events. As autumn turns to winter and the rates of infection and transmission begin to rise, this narrative is likely going to be ramped up further and further. The great turn against the unvaccinated, I think, is only just beginning. This isn't just an issue about social justice or discrimination. If this starts to happen to us, it will have a profound effect on our collective mental health. These social divisions are going to make us all suffer. Not just the people who don't get vaccinated, all of us will suffer if we split and turn against each other in the name of eradicating a virus. Because this kind of polarisation, this two-tier society, it isn't just an abstract concept. These divisions, the social split between the vaccinated and the unvaccinated, will play out in the arena of real human relationships, and this will be profoundly damaging to us all. Already, we are seeing families splitting up over the different takes on these issues. Spouses are divorcing, children and parents are no longer talking, loyal staff members are suddenly being shamed, then threatened, then fired. Lifelong friends are blocking each other on Facebook, people insulting each other, doubting each other, calling each other crazy, selfish, brainwashed sheeple, losing all sense of each other's good intentions and our love for each other. And as these polarisations intensify, all of these ruptured relationships will have a profound mental health impact on society as a whole. Because as a relational therapist, I believe that good mental health is rooted in strong, healthy, contactful human relationships. It isn't just about chemicals in the brain. And if you create a situation where all across the country we're being systematically turned against each other, and thousands, millions of relationships are being needlessly ruptured over this one issue, then we are all going to be impacted, whatever we do with the vaccine. Relationship breakdowns are a primary cause of stress, depression, anxiety, anger, and many other social harms. If our society becomes profoundly divided and polarised to the extent that I fear it might, we are all going to suffer. So before I end, because I want to end on a bit more of a cheery note, I guess I want to talk a little bit about solutions. So if vaccine passports do come in this winter, and I think like many of us sat here, probably I think they will, then what can we do to help minimise the harm they might cause to society, and what can we help to do to protect our own mental health? If or when vaccine passports are introduced, I think first of all I would say if you can possibly get away with it, have nothing to do with them and boycott. But if you absolutely have to do it for some reason, then I would say the second most important thing is to just not buy into the narratives that come along with them. The biggest mistake we can make in this situation is to start to internalise that standing up for our individual rights and freedoms is selfish, that it's the polar opposite of caring for each other, that fighting to protect our individual rights is the antithesis of being community-minded. I would say that this is a false and very dangerous dichotomy. Individual freedoms are precious, and they're worth protecting because they benefit society as a whole. Our right to individual subjective opinions, to free speech, bodily autonomy, informed consent, freedom of movement, the right to a private life, these things are precious human rights, and with the introduction of vaccine passports, they are now seriously under threat. Wanting to protect these rights does not need to be at odds with a sense of collectivism or social responsibility. When our individual rights and freedoms are protected as part of a free society, then they generally benefit the health and well-being of everyone. To lose them will cause us far greater harm than COVID-19 ever could. Historically, societies which have removed individual rights and freedoms in the name of a greater good, even in the name of health, usually end up being profoundly sick societies. This is the hallmark of most totalitarian regimes. It's not selfish or uncaring to want to protect your own individual rights. Don't buy into that polarisation. It's utter nonsense. On a relational level, it's important not to let vaccine passports divide us, to not allow ourselves to become two warring groups of vaccinated and unvaccinated people. Whatever your individual medical choices happen to be, don't let this poisonous narrative split you from your friends or your family or anyone else who matters to you. However much the media, the politicians are trying to turn us against each other, let's not let ourselves be split from each other or turn against each other, because that way madness lies. And finally, as a humanistic therapist, I hold that to truly support mental health and human flourishing, then we must have free and unrestricted access to the parts of life that have always been central to human joy and flourishing through the course of our collective history. Dancing together, smiling at strangers in the street, travelling to new places, eating a meal together with friends, being present at births of new family members, nursing our loved ones through illness and death, grieving together, going to the theatre, listening to orchestras, singing, jumping up and down in mosh pits, arguing in the street when we've got too drunk, having a good snog with a total stranger. All of these things really matter. Acts of joyful, creative, social connectedness. These little rituals and big milestones of human life. These are not optional extras that we can just suddenly live without for months on end. Nor should we grant our government the power to take them from us in the name of keeping everyone safe. I believe that now is time for a collective, creative, civil disobedience, to push back against these draconian and ineffective public health interventions in whichever ways best fit our own unique situation. And if there is an opportunity in this situation, I don't think it is to build back better, to embrace a paranoid and atomised new normal. Instead, I believe the current situation offers us an opportunity to gain a new appreciation for the joys and sorrows, the agonies and ecstasies, the possibilities and limitations of being fully human. Like it or not, this situation gives us a chance to reaffirm our commitment to the human rights and freedoms that really matter to us most, and a chance to fight to defend them. And finally, and I think most importantly, this situation will give us a chance to make more friendships and learn new skills, to stand united with our friends and our loved ones, even with our differences, and in the face of many ugly attempts to divide us. Thank you.